Researchers at South Korea's Centers for Disease Control now say it is impossible for the coronavirus to reactivate in the human body. According to scientists, hundreds of patients reported to have relapsed after recovering from the disease. While they were actually well, but the tests were flawed. So does that mean they're now immune? Kelly Kobiea is in Seoul looking for answers.
Scientists here in South Korea were trying to figure out why about 260 patients who had contracted COVID-19 and then recovered were testing positive again for the virus a few weeks to several weeks later. They were concerned that these people hadn't developed enough immunity and maybe were getting reinfected in the community, or possibly the virus was going dormant in their bodies and then reactivating a few weeks later. What they found when they took a closer look at the tests that they were using was that it was really sort of a problem with the tests. The tests can't differentiate between live viral cells and dead cells. So what the tests were picking up in those positives several weeks later were actually dead viral cells still in the body.
It's not infectious virus, it's not reinfection, it's not reactivation. It's actually part of the healing process that is being captured again as being positive.
A big relief. It means these patients aren't getting reinfected, and it also means that perhaps people are gaining some sort of immunity from the virus.
Fewer people are being screened for cancer because of the coronavirus, according to a new study from the medical record company Epic. Researchers looked at data from nearly 3 million patients across 23 states. They found appointments for breast and cervical cancer screenings were down 94% in March compared to the last 3 years. Colon cancer screenings dropped by 86% in the same time period. Face masks are an important way to keep the coronavirus from spreading, but you may find they irritate your skin. Dermatologists with the Baylor College of Medicine say if they do, you should pay attention to the type of fabric you're using. If you're prone to acne, avoid polyester because it can trap sweat underneath it. Try a more absorbent material like cotton. People with sensitive skin should use a soft fabric for the inner layer with a thicker weave for the outside. Another tip, if your skin is dry, apply moisturizer before wearing the mask.